I'm Tori Hall, and this is Mr. Duco.
Hi.
And he's here to talk to us about home safety. What is abuse?
Abuse, there's 5 different kinds of abuse. There's physical abuse, neglect, emotional abuse, sexual abuse, and self-abuse. Abuse is non-accidental injury of someone or drugging them. Neglect is an act of omission that jeopardizes the safety or well-being of a child. It could include not providing food or shelter or protection or clothing or medical or dental services. Emotional abuse is consistent pattern of being insulting or critical of or really punitive toward a child, that in such a way that it results in damaging their chance for normal growth and development. It also can be between 2 adults as well, or a boyfriend and girlfriend. Abuse is any sexual contact between an adult and a minor. Self-abuse can include mutilation, like cutting or scratching yourself, hitting or bruising yourself, suicidal gestures, or attempts. Alcohol and drug abuse is considered self-abuse. Poisoning your own body is self-abuse. Eating disorders is included in that too, like anorexia and bulimia.
How do people get away with this?
Well, what happens is typically when the abuse is between an adult and a child, the adult has worked to gain the child's trust, so that the adult is really important to the child, and the child then typically won't tell anybody because they don't want to get that person in trouble, or they might not realize that what's happening to them isn't normal, depending on how young they are and how long they've been involved in this. They might think this is just normal, so they might not get it. Some of them may worry about retaliation from the adult if they tell. They also might worry about whether someone would even believe them if they told them, and sometimes they're just really ashamed of themselves, or they blame themselves for the situation. And in some cases, when kids are really little, or if they have a disability that causes them to be nonverbal, they may just not have the words, not be able to really tell people what's going on in such a way that other people understand.
So what can I do if I see this going on?
Okay, you can make sure you educate yourself on what abuse is, so you do know what you're seeing. The best thing to be is a good friend to someone. Listen to them, and then encourage them to go get help. And when you're listening to them, be non-judgmental, make them feel comfortable, and then try and convince them to go talk to somebody. And they can talk to, and probably at school here, the best people to talk to would be the counselors or Come to See Me. But any adult who works in public schools is what we call a mandated reporter. So any adult that the person might feel comfortable talking with would be someone to talk to. And what a mandated reporter is, mandatory reporter is someone who must report any suspected abuse to Child Protective Services or the police. And also, if the person is not comfortable talking to somebody at school, police, of course, you could go directly to them. You could call Child Protective Services. And medical professionals are all mandatory reporters as well. So someone could talk to a doctor, or certainly you can talk to our school nurse. And that's pretty much what you can do, is just try to get them some help.
All right, thank you so much.
You are welcome.